Right. Good morning, everyone. So this is Monday morning in Melbourne. We have Matt Pallozzi. So he is a practice owner, a sports physio, and also the chair of the APA. So we have him on our podcast, the Business of Allied Health, Physio Business Association, Victorian Branch. It's not really a podcast. It's more like something I'm going to publish on the CliniScribe page and cut snippets for everyone to enjoy and find useful tips from that in your time poor lifestyles. Welcome, Matt.
Thanks for having me, Barry.
Yeah, so I'd love to hear about your story. It sounds quite interesting. How did you start as a physio? And I think you started in footy and went into your running your own clinics.
Yeah, so I guess I feel quite lucky because you talk to any grad or any young physio and they'll give you a multitude of, different career paths that they want to go down and different opportunities that they want to pursue. And I've been really lucky because I've kind of done a lot of them. So my first physio job post starting out was in the hospital. I sort of thought I wanted to experience what the public hospital system was like. So I worked for a couple of years for Eastern Health. And as much as that wasn't, I think, my end game and where I knew I wanted to be long term, it was a really good grounding experience and a really good place to learn. And even just basic things like basic professionalism. I think if you're getting into I worked in retail through uni. So you go from a retail job into, in my mind, a real job and what we'd studied for 4 or 5 years to go out and do. As much as it wasn't what I wanted to do long term, working in the public health system was just a really cool experience. So I worked for Eastern Health for a couple of years and I got very lucky with my early rotation. So I was doing a lot of outpatients, emergency department, community health, things that were going to set me up for success as I moved into the private practice mask world and then as I went into the sports world as well. So I did that for a couple of years and then I got a tap on the shoulder from a friend of mine who was working at another clinic. He and I had gone through uni together and he said, "Mate, there's an opportunity here in the practice. Why don't you come over and, in his words, get a real job, get a real physio job." So I did that. I worked there for a couple of years again. And then through talking to my then boss, I got really inspired to start my own practice. And we almost did something together, my old boss and I. And unfortunately, it didn't work out, not because of anything between he and I, just the opportunity sort of had moved on. But I'd got a bit of a taste and hunger for it. So then in 2017, mid 2017, I started to basically look around at commercial leases and took out my first commercial lease in about August of that year and then opened the doors of Instinct Health on the 13th of November 2017. And that was where the clinic side of it all started. Coincidentally, and again, you talk about our world being very people focused and it's all about who you know. From someone that I'd met in the public hospital system, there was an opportunity to get involved with AFLW in its infancy. So AFLW was kicking off in Australia, but particularly in Victoria. There was 6 teams in Victoria, I think, that started out, and I got an opportunity with Hawthorn. So I had the clinic, I was in startup mode for the clinic, and then also had the opportunity to start to get involved with women's footy as well. And then I worked in the AFLW world across 3 different clubs, so Hawthorn, then Carlton, and then Collingwood for 8 years. And then as I was getting towards the end of that 8th year, I knew that there was an opportunity to take over a second practice. So I've got Instinct Health in Camberwell, and now we've got Instinct South in South Melbourne, recently rebranded. So if you do know City South Physio, it's now Instinct South. And that's sort of where I sit today. So I've got the clinic in South Melbourne, I've got the clinic in Camberwell. And then as you alluded to, I also do a little bit of voluntary work for the APA. So I chair the Victorian Business Group. So we essentially are there to upskill other business owners in Victoria. I have a bit of liaising work with some of the national committee members at a business level. So we're there to provide PD for members, provide support for members if people have questions about their business or somewhere that they want to go for an answer. They come to us and then we can hopefully take it back to the right people at the APA. So yeah, that's kind of my juggling act at the moment about where my professional career sits now.
Wow. So I'm just going to drill down those questions. So at least in my time, 20 years ago, it was like people who were adamant that wanted to go into private practice first year, and then there's others that went to the hospital. What skills did you learn in the hospital that were transferable to private practice? I think you alluded to something like professionalism and things like that. Can you maybe elaborate a little bit more?
Yeah, so I think there was a couple of reasons why I wanted to go into the public health system. Knowing how the system works, I figured at some point in my life, I was going to have a friend, a family member, or a relative, or someone go into the public hospital system. And so I think it's nice to see how it works from the inside. But in terms of some of the skills that I picked up, the major ones that stand out are liaising with other medical and allied health professionals. It's very, very team focused working in the public hospital. So it's you're there, and on the ward is nursing staff, medical, but then all of the other allied health disciplines as well. And then having meeting with them every day or every week or whatever the setting is, depending on the ward. So being able to cross refer, I think, has been a really powerful skill that I've been able to pick up. Likewise, relationship building. One of my early jobs working at the Angus Hospital up in Fentree Gully was working in the fracture clinic. So it was the patient would come in from the emergency department, they'd be diagnosed with a fracture, and then they'd say, right, go and be seen in the outpatient fracture clinic. And then the fracture clinic was myself, the patient, and an orthopedic surgeon. And I learned so much about radiology, managing fractures, how an orthopedic surgeon talks to a patient, all those sort of things. So some of that relationship building, I think, was really key as well. And sort of as I alluded to from a professional standpoint, family members in particularly distressed situations are often looking at you for answers, and you have to provide them, or you have to be able to know where to go or who to go to provide them. So I think handling some of those difficult conversations was also probably a skill that I acquired in that first couple of years of working in the hospital system. And again, those skills are still things that I would use today, whether it be with clients, and I still treat clients to this day, but whether it be with clients or now challenging conversations with staff as well.
That's excellent. So you learn a lot of sort of your social skills, your teamwork skills,
Yeah,
politics as well in there.
politics, absolutely. And we run small businesses, right? So
Yeah, we do.
we can be flexible and we can be dynamic, but
Yeah.
working in an environment that is much, much bigger than you, and you're a very, very small cog in a very big machine, was a really formative experience. So yeah, learning about how the big picture works was huge for me.
Yeah, I absolutely love it. So you sort of learn how institutions work and the hierarchies and things like that that you can't change.
Absolutely.
And sometimes
And
that teaches you what not to do as well.
yeah, absolutely right. And particularly when it's publicly funded money. This was not a private entity, and private hospitals, to my understanding, are run in a very similar way. This is not a big corporate firm. This is a government-backed entity.
And I'll say at a sports club, like an elite sports club, would be have some of those tenants there too.
Yeah, absolutely. And again, we think we're the most important person in a footy club or a sporting organisation as physios, but the reality is we are often out of sight and out of mind. And after working in footy for a couple of years, that was something that I was very comfortable with as well, and happy to be there in the background. But you're right, that goes all the way up to board level in footy club. So you've got to realise where you sit within the broader ecosystem.
Yeah, I was speaking to Damien Raper. I think he's a head physio at Sydney Swans, and he was telling me, like, he was just giving me some insights, and it was like, footy's just the entertainment industry.
Yeah, it's big business. There's a lot of people involved. Yeah, and it's the AFL has a responsibility to put bums on seats and make it commercially viable as well.
Yeah, so it's not necessarily the priority is about health and injury prevention. It's about
we focus on that, but particularly my role as head physio, I had to have an eye on my team, my physio team, the medical team at large, and then importantly, the flow and effect to the players of that as well.
Oh, wow. Yeah, very interesting. So back to startup mode. What was your biggest challenge starting up Instinct Health, your first one? Did you take out a loan to get that commercial lease? How did you find that place? What strategies did you use? Did you have a coach, or how did you go about that?
It's funny, if I knew now what I knew back then, I would have done things drastically differently, but I wouldn't know now all the skills that I have if I didn't just kind of do it very bare bones. And I would say bare bones was absolutely the underpinning theme of the way that I did it. So it was thin for a very long time, put it that way. So I just jumped on Seek Commercial one day, and the building that I found happened to be vacated by a current physio clinic. So they were moving down the road. As we know, it's a very saturated market, and naively I thought, well, maybe that's a good opportunity because someone will walk in the door and think that I'm them and I'll steal a patient or two. They were very clever and they didn't let that happen. If someone walked in and had an appointment with someone else, they probably would have just walked back out. So I think that was one of my naive learnings from way back when. But from a commercial point of view, I lived off savings. So I've always been a saver and not a spender. And I had a bit of money behind me that I was able to put towards the fit out. And I said it was bare bones. It was a mate of mine who's a carpenter who threw the walls up for me. I learned how to plaster in that experience. I got better. I wouldn't say I got good, but I got better at painting. And then I leaned on every single person that I knew. Luckily, I had an electrician mate and a plumber mate, and I was able to just sort of pull levers and offer contra deal. So I'll bring you back and you can plumb the new toilet for me. There was all those sort of things. So really the biggest cost to start was just the setup. So, some Pilates reformers, some treatment tables, but I did it periodically. So because when I started, it was just me. I was answering the phones, I was treating the patients, I was running all the marketing, I was doing all those sort of things. I didn't need a second treatment table because it was just me. So then when I hired my first staff, I thought, I probably need a treatment table for that room. And it just grew from there. I tried to do little things to make it feel better than it was. If I wasn't treating, I'd always just close the other doors in the consult rooms, make the clients feel like there was other people going through the practice at the time. But yeah, I think the biggest challenge was basically starting from zero. I had a handful of people who had followed me from my previous job, but I was also really mindful that my boss had been really supportive of me when I'd been in his practice, and he'd been really supportive of me leaving as well. And we still have a really great relationship now, that I didn't want to be a mercenary and take all of those clients with me. I wanted to do the right thing by him. So there was naturally maybe a dozen that followed me, but outside of that, it was kind of starting from square one. So the biggest challenge was literally just growing the database and growing the clients. And we are very much if you do a good job, you'll get word of mouth referrals, but you got to have that critical mass of people to get people in the door to start to talk about you and spread the good word. So I had a very early business coach who I worked with for probably 2 years, who was good to just give me some really basic tips. And if I look back at some of that advice now, and I've done so recently, I've looked back on it from time to time, but if I look back on it now, it was really basic, but I needed that at the time. I needed some of those really basic tips. And since then, the network of people that I can lean on or ask questions of has grown, which is really handy. So now I kind of know who I'll talk to for this sort of question or that sort of question. And luckily, I've got a network of people who I said have got a real growth mindset and happy to share their information. And there's no secrecy or, I don't want to share this with you. So yeah, that's probably the biggest thing that's changed over time.
Fantastic. No, I love those stories. It's always very similar, like buying IKEA furniture, fitting it together, all of that type of stuff. It's really interesting. No one starts off with a polished practice is the lesson there. And
No.
probably being frugal is better. Yeah.
And I think probably the lesson for me was, as I said, I've always been a saver and not a spender. I didn't draw a cent from the business for the first 2 and a bit years. And then, to be honest, it was during COVID because I was an employee of the business and there was all the government support that was being offered for employees of businesses, I got a pay rise. I went from 0 to whatever the minimum wage was that the government were offering. Despite being a really challenging period and not knowing whether you're going to be able to open or not, I was still able to at least pay myself for the first time in 2.5 years.
I love it, man. That's like founder mode, founder hustle.
It was very much, founder startup mode. Yeah, absolutely.
Yeah. All right. So what's one key single metric that is the most important for you to measure in your business now?
Yeah, I think so. I've developed over the 7.5 years of running the business a weekly dashboard, so a KPI dashboard, which all of the staff, whether it be admin or clinical staff, all have access to. I did it for a long time. I've now got a wonderful practice manager, and so she populates it for me for both clinics. But we track a number of things on there. The biggest thing for me, and I think there's some contention in the profession around what you should track these days.
Yeah.
But for me, the biggest things that I look at are utilization and client visit average. So I think you can hyperinflate both of those things. So you can hyperinflate client visit average, a largely compensable.
Yes, you can.
Clinic, and so private client visit average, I think, is the metric to go for. And James Schomburg often talks about this, and I think he's an absolute guru in this space. So private client visit average, I think, is a really good metric of, are you able to retain those clients? And you say retention, and there's this discussion around, is it a dirty word, but can you take them to the end of their episode of care? Because if someone comes in and you've seen them once or twice, but you can't categorically say, yes, you are back to 100%, or you're better than what you were when you walked in, have you really done your job that well? And that's the question that I always ask of my team. Are we getting people back to 100%, or are we getting them better to what they perceive their ceiling to be? And utilization is the other thing. You also need to have enough new clients coming in the door that you can fill your books. So you need to be busy and servicing those clients well and taking them through their episode of care. And I think those are the two things that I look at as the biggest pulse checks within my clinics to give me, yes, it's retrospective data, but give me data as to the health of the clinic.
Love that. Just as a note there, you can't just look at the PVA on Clinico or Nucal.
Yeah.
If most of your new grad saw that compensable patient for over 30, 40 times, which grossly makes those metrics not meaningful. So I love that point you made there, that need a bit more be a bit more critical around these numbers and working out where the real value is in building your practice.
Yeah, you can have falsities in these numbers because you could have a really high utilization but a really low client visit average. So you could flip that around completely. You could say, well, geez, what's going on there? And you might have really incredible marketing strategies within your practice. And so you're able to get huge numbers of whether it be new clients or returning clients coming back to the practice. But if they're only being seen once or twice, then you're also hemorrhaging those clients back out the other end. And again, are you helping them in one or two sessions? And that would be the question that I would ask. So I think it's always good to look at it, not just in raw number format, but also take a step back and say, okay, well, are we trying to achieve good clinical outcomes or not?
Yeah, I love that. Like that bigger picture view. Like, I mean, that could have cost you a lot more to get that client into your clinic. The
Absolutely.
cost of your receptionist talking them into it, the cost of the Google ad or whatever it is,
Yeah.
and then the cost of the person you hire or the percentage you're paying them. So yeah, absolutely. So if there's one lesson you've learned that you haven't heard before on social media, and I know there's a lot of debate and things like that we see on Facebook, LinkedIn, particularly in our profession,
Yeah.
around practice owners, around these metrics, as we said earlier, etc. What one unfiltered lesson would that be you'd love to share that's going to be on social media from this?
It's funny, this might be a little bit controversial,
Doesn't
but I
matter.
think so many practice owners have this mindset that I'm the best clinician in the practice and I have to do everything, and they're often busy. And so that means that other areas of the practice maybe suffer. But I think the biggest thing that I have learned is as practice owners, we are not substantially better than the rest of our team. And if we take that step back and realize that someone else can do the job and they can treat the clients, run the classes, build a relationship with a great referrer, if we take that step back and empower our team to do these things, it actually gives us the opportunity to have a bit more time and space where we can maybe work half a day less because we know that our team have it under control, or our team get busier because we're not holding on to all of this existing caseload. And so they get to see all of their ideal clients. So I
Yeah,
think maybe I'm going to piss a few people off,
I
but
think you will, but
I would say to practice owners, you're probably better than the rest of your team, but you're not so much better that you can't empower them to become great clinicians in their own right. So that would be the takeaway: is let them make mistakes along the way, and you just give them some guide rails to know that they're going to be safe and importantly doing a good job
I,
as they go.
yeah, I absolutely agree with you on that point. I mean, for me, I guess because I run a software company now, it's a bit different and I still practice. But this theme coming through is that growth mindset, not thinking scarcely about your resources
Yeah.
and not trying to flex because you're seeing all the elite sports patients while your new grads get all the
Yeah.
the lower value patients. So yeah, to build your clinic, you need to just really take a step back and sacrifice and be humble. That you,
Absolutely.
I
And
love
the,
that.
the
Yeah,
statistics around profitability in our world are nowhere near what other industries are. We're not in the fintech world where
yeah,
someone's going to come along and give us a 100x multiple and our practice is on the way out. So to be able to scale and grow, you got to have great teams. And to have great teams, more and more data comes around, is coming around about empowerment. So you just have to let your teams do their job and in some respects not get in their way, and you can just be there as the coach and the guide to make sure that they deliver great outcomes and have really good client success stories as
no,
well.
absolutely love it. I've noticed that even in my clinic where you start to entrust the new grad into these things and they appreciate you more and they
Absolutely.
start to feel empowered, as you said. So yeah, thanks for that. That's awesome. I love the points you made there. I think there's a few controversial ones there. We'll see. We'll see.
Maybe.
It's been a pleasure, Matt, and hopefully we can have maybe a follow-up session some other time around that.
We can go a little bit deeper on some of the
Yeah,
more
we can go. We
controversial.
can go deep into a lot of those things and get a bit more controversial. Thanks, Matt. Thanks for your time.
Thanks, Barry. Cheers.
All right.